So it's a 22-year-old, history of seizures, initial dislocation, traumatic, treated arthroscopic Bankart, capsular remplissage. So this is sort of a multi-stage case here. This is, I think, the initial scope cases. And I know we won't kind of talk too much about this, but do you guys, let's say Peter, do you ever kind of go into these cases and you see really shitty tissue like this and just abort, or do you just go follow through with the plan?
So you're saying that you just do a bad surgery?
Well, I mean, just saying you made the decision to do a remplissage, which I think a remplissage of the Bankart is a reasonable thing for for a first-time traumatic dislocation. But then you encounter this where you may not be expecting bad tissue.
Yeah, I had that happen with an NHL player. That was, the team doctor didn't think he needed a Latarjet. I said, we should have that available. The tissue quality was really poor, and I was surprised it was as poor as it was, and I converted to a Latarjet as a primary procedure for that very reason.
So aborting based on sort of the intraoperative findings there.
Yeah, so that's why I said in my talk, use all the information. Obviously, it's good to be prepared as much as you can, but the EUA and the diagnostic arthroscopy, I think, can give you a lot of information.
Yeah, all right. So I'm going to breeze through this because it's sort of a kind of tiered case here. So he's 7 months out, and then he has this failure. So Alex, what do you think about these films here?
Yeah, so you can see on the axillary, he's anteriorly subluxed. Is he symptomatic as well, I'm assuming?
Yeah.
Painful. Yeah, so he's failed, and I think that's a conversation of we need to reconstruct the anterior glenoid. In my hands, that's more of a DTA in my practice, and open.
Okay. So we don't have a CT or MRI with this. This is sort of what you got here.